Hi, my name is Martha. I'm a nurse practitioner student at Indiana Wesleyan. I'm going to do your exam today. I'm going to look at your head, your eyes, ears, nose, and throat, look at your neck, as well as your skin and your hands. Can you tell me your name?
Allison Freeland.
Okay, and your date of birth?
I have 1386.
Okay, so I'm looking for any distress. Allison is very calm. I don't see her using any intercostal muscles to breathe, so we're going to start our exam. I'm going to look at her head. It looks symmetrical, midline, and normal cephalic. I'm going to palpate her scalp for any trauma, hair texture, any lesions. Looks good. Looks like she's in good health. Now I'm going to look at her neck. I'm going to look for the trachea. It's midline. I'm going to visualize for any kind of enlargements. I don't see any. So now I'm going to palpate her thyroid gland. Okay, can you swallow for me, Allison? Again. Okay, what I feel is a small, smooth thyroid gland, which is good. And now I'm going to feel for her, I'm going to palpate her lymph nodes. So we'll start with the pre-auricular, post-auricular, occipital, submental, submandibular, a superficial deep anterior, then the posterior cervical, okay, and then the supraclavicular. Is there any tenderness in there?
No.
Good. Okay, so now I'm going to look at her skin. It looks smooth. I don't see any rashes. Let me see your nails and your hands. They look symmetrical. The nails look well taken care of, clean. The cap refill is less than 1 second. While I was looking at her skin, I see a little mole down there. It's very small. It looks symmetrical, round. The color is even throughout. The diameter looks definitely less than 6 millimeters. And has that, the borders look good. It's not blurring. Has that mole changed in the last few months?
No.
Okay, so the evolution, there's been no evolution, so that's good. So right now I'm going to look at Allison's eyes. Her lids are opening and closing symmetrically and completely. I see her sclera is white, good. Her irises are blue. The cornea is translucent. I see her eyebrows are thin. Do you pluck your eyebrows at all, Allison?
Yeah.
Okay, and they do extend to the outer portions of the eye. Let's see. Now I'm going to look at her pupils. All right. I'm sorry, this might be a little bright on your eyes. Just look that way. Good. Okay, so her pupils are equal, reactive, round, and responsive to light. Reactive to light. Now I'm going to check accommodation. Check a look at my finger, and then just follow it as it approaches your nose. Okay, she has good accommodation. So right now I'm going to look inside to her retina, do a exam. I would ordinarily dim the lights, but we don't have that capability right now. So Allison, just pick a spot in front of the room here. I'm just going to look in your eye. I'm going to look for a red reflex. Oh, I see it. Okay. The red reflex is where the light illuminates the retina. So I'm going to look a little closer, and I see your ocular disc. That is where the retina and the ocular nerve converge. And I do see the blood vessels, which appear to branch away from it. The ocular disc looks yellow, orangey, and the margins are clear. Okay, thank you. All right, so right now I'm going to check Allison's peripheral vision. I have these two markers.
Okay.
Pick a spot in front of us. And when you see the markers in your periphery, just let me know.
Okay, I see the left. Okay, I see the right.
Okay, thanks, Allison. So right now, I'm gonna look at Allison's ears, okay? They look symmetrical, even. I'm just gonna palpate them for any kind of nodes, any tenderness. This is the auricle, the earlobe, and the tragus. Any discomfort, Allison?
No.
All right. So I'm gonna take a look in her ears. So right now I'm going to examine her external ear meatus. Okay, can you tilt your head to the left a little bit, Allison? All right. Okay, I don't see any exudate, minimal cercumen. I see her tympanic membrane. It looks pearly gray, pearl and translucent gray. I do see the umbrum. I see the malleus, and I see the reflection, the light reflex. Good. Any pain in your ear?
No?
Okay. All right, so after the ear, we are going to look in your nose.
Okay.
All right. So right now I'm looking straight away at Allison's nose. I'm looking for if it's midline, symmetrical, any kind of deviated septum, which I do not see. I'm going to check for patency. Allison, cover one of your nares and breathe in and out of your nose. Okay, now how about the other side? Okay, there's patency. I'm just going to look a little bit in your nose there. All right, I don't see any bleeding, no crusting. The mucosa looks pink. Very good. Now I'm going to assess Allison's sinuses. We'll start with the frontal sinuses. I'm just going to touch here your face. Any discomfort?
No.
All right, now the maxillary sinuses. Nothing?
No? No.
Good. Okay. Now we're going to look at her mouth. Right now I'm looking at her lips. They're pink, slightly chapped. Let's see. Even. You know what? I just remembered I forgot to check Allison's cranial nerve 2, her ocular nerves. So let's do that. I'm sorry about that.
Okay.
All right. So right now I'm checking the movement of your eyes.
Okay.
That's cranial nerve number 2. All right. Just keep an eye on my pen and just watch it. Just let your eyes follow it. Good, Allison. I noticed no tremors, no nystagmus, no strabismus. Strabismus, no strabismus. You don't have any strabismus, Allison.
That's good.
All right, so let's go back to looking at your mouth. It's pink, it's even, it's symmetrical. There's a little bit of chappedness, but it's cold out. Let's see. Now, can you smile for me? Good. Let's see your teeth a little bit. Good. Can you open your mouth? I'm just going to look inside in your cheeks. All right. Her teeth are all there. I don't see any lesions. Her tongue looks a pale red, which is what we want. Can you lift up your tongue? Okay. The frenulum looks intact. Let's see. Now we're going to check her cranial nerve 12, or hyperglossal nerve. Allison, stick out your tongue. Move it to the left and the right. Okay, no deviations, no tremors, able to follow direction. Okay, now we're going to look back in your mouth. I want you to open up and say, ah.
Ah.
Good. Ah. Okay. So the hard palate is symmetrical when it rises. Oh, it's dome shaped. Okay, one more time. Okay, the soft palate is symmetrical as it rises. The uvula is midline. No arrhythmia, no lesions. The tonsils are grade 0 bilaterally. And I do not see any lesions in the back of her throat or ulcers. Okay. Thank you, Allison. It's been a pleasure.
Yeah.
Thank you.
Thanks, Martha.